It is with great pride and humility that I take you through the journey of Vitala International Institute of Ophthalmology, a journey spanning across 4 generations of ophthalmologists and more than 100 years of dedicated ophthalmic care. Dr. VIIO, who was the personal physician to the Maharaja of Mysore, started Provide Clinic in 1940 upon his retirement from government service. He was trained in ophthalmology in the early 1900s in the United Kingdom, and he was instrumental in bringing quality eye care to India. After Dr. VIIO's retirement from active practice, the mantle of leadership of Provide Clinic was taken over by his son-in-law, Dr. Krishna R Murthy. Dr. Krishna R Murthy expanded Provide Clinic to make it one of the premier eye institutes in Karnataka. Meanwhile, his son, Dr. R Murthy, after finishing his training in ophthalmology in the United Kingdom, gave up a consultant's post and a plush job in Canada to return to India and serve her people. He worked with his father, Dr. Krishna R Murthy, and took Provide Clinic to greater heights, but his real dream was to reach out to the rural and economically underprivileged population of India. Initially, he organized many camps in remote and rural areas of Karnataka to address the problems of curable blindness. His zeal to work in rural areas was not limited by national boundaries, and he actively participated in camps conducted in Tanzania and Ceylon. In 1988, he started Sri Keshava Trust, a public charitable trust whose primary purpose was to provide world-class eye care to all sections of the society, irrespective of their economic background. The Keshava Trust made a humble beginning by starting 5 rural outreach centers around Bangalore, but it soon became evident that running 5 rural centers with limited resources was extremely difficult. At this juncture, when Dr. R Murthy was at the crossroads and not sure of his future plans for Sri Keshava Trust, in 1998, the Karnataka government leased a plot of land to Sri Keshava Trust to start a super specialty eye hospital. The Vitala International Institute of Ophthalmology building was started with some internal funds and some generous donations from individuals. Halfway through the construction of the hospital, all monetary resources were exhausted, and Dr. R Murthy was once again at the crossroads. Around this time, Sri Dhirubhai Sangani was exploring the possibility of starting a charitable eye hospital in Bangalore in memory of his late mother. When he heard about the proposed hospital coming up, his entire family supported it to realize its completion. We were also very fortunate to have had the blessings of many learned men who visited the hospital during its construction. Prominent among them was Bhai Shri Ramesh Bhai Oza, Maulana Wahiduddin, and Pujya Shri Pramukh Swami Maharaj. On October 28, 2001, patient care services were started in Vitala Eye Hospital with the specific goals of patient care, education, and research. Between 2001 and 2003, a large number of camps were conducted in rural areas to identify and treat conditions of curable blindness. More than 15,000 free surgeries were performed during this time. This created a cash flow problem. So in 2003, a crucial decision was taken to tackle the need for funds in a project or mission-oriented manner. The aim was to create a sustainable charity. Our first success was in starting a free pediatric ophthalmology clinic at the Indira Gandhi Institute of Child Health, which is a government hospital with support from the HHH, a charity based out of USA. Our next major achievement was in 2005 when we were able to build the world's first mobile advanced eye treatment unit, which is capable of delivering super specialty eye care in rural parts of Karnataka. The project was named Nayana and it continues to serve 14 districts of Karnataka. This project was supported by grants from the World Diabetes Foundation, and we are proud to say that this model has already been replicated in 17 locations across 9 countries. In the year 2008, the Ramachandra Center for Excellence was established with the help of generous support by the Bharat Family Fund. This center caters to patients with glaucoma, providing state-of-the-art care. Retinopathy of prematurity is a leading cause of childhood blindness the world over, and the solution for this problem lies in early screening for the disease and prompt treatment. The Vitala ROP clinic was started to address this blinding disease of the newborns with the help of a generous seed fund given by Shri Amit Sangani. On 20th of September 2009, Project CODE, which is an acronym for Comprehensive Diabetes and Eye Care, was started to raise the level of general diabetes care across the state of Karnataka to standards accepted worldwide. With each passing year, the demand for free and subsidized work is increasing. In 2001 alone, concessions accounted for over $250,000 US. Today, we appeal through this presentation for your generous support. Thank you.